Welcome back to Tiyo today. This is Tiyo and welcome to our daily video challenge, 90-day daily video challenge. And in the previous videos, we already started with level number 2, financial security. Okay, so yung level 1 is financial stability. If you haven't watched those videos, balikan mo yung mga previous videos. So ngayon, let's proceed. Level number 2, financial security. So in building a building a solid financial foundation, dapat we need to build it right. Okay. First in the foundation is savings for healthcare. Okay, we need to save first para sa sarili natin. Because again, we are the money machines for our family. We work so hard, we earn money so that we can provide para sa kanila. The question is, what if something happens to us? Magkasakit, okay? Okay? So what happens is, mas stop yung flow of income para sa family. Okay? Pwedeng ma-affected. That's why it's very important. We need to first save for ourselves. We need to prepare first for ourselves. Alright? So, normally, ito yung normally neglected savings. The savings for healthcare. Why? Because most people, they have what we call a company HMO. Okay? Baliktad to. Company HMO, meaning benefits ng company. So, if they're currently working ngayon, they're currently covered with the company HMO, which is okay. Okay yun. Okay? Pero, you are only covered as long as you are employed to that company. The problem is, what if you retire, you resign, you cannot bring with yung benefits mo sa company. Yan yung disadvantage. Alright? Another thing, people neglect this one kasi they're gonna tell you na meron na silang PhilHealth. Okay? Which is okay. PhilHealth is very important. Okay? It's a company's benefits. Is the government benefit para sa atin, so it could also help us dun if ever we go into hospital, di ba? PhilHealth. Pero again, PhilHealth will not cover everything. Okay lang if you're gonna go into a government or a public hospital. Tama ba yun? Okay, government hospital. But, ayun nga minsan mag-i-exceed pa rin unless no balance billing, di ba? Okay yun. Pero of course, if we have a choice, we wanna be admitted in a private hospital, di ba? And usually, private hospital, they cost more. And PhilHealth will not cover everything. Okay? So that's why it's very important na meron tayong healthcare savings. And very important thing to note is dapat meron tayong short-term, okay? HMO. This is the one yearly renewable. Okay? Renewable yan yearly. And usually, it is a benefit, it's a company benefit. So, if meron ka nito sa company mo, congrats. Not all companies provide that kind of benefit. You utilize that, be grateful, maximize that one. And then next is you need to have a long-term healthcare also. Okay, we need to have a long-term healthcare program also. Meaning, by the time age 60, 65, 70, meron pa rin tayong program that will cover us long-term. Okay, so there exists a long-term healthcare program. Okay, you save right now, and by the time we retire, years from now, we are still covered. Okay, kasi again, ito yung mostly neglected is savings for healthcare. A lot of people, they retire. Yes, they receive retirement money. What do? They spend it. Tapos magkasakit, yung retirement money which suppose they will gonna enjoy, they spend it all for health care. Okay? So, healthcare needs. Kasi they don't have a long-term healthcare program. They don't have a long-term healthcare savings. Okay? For that kind of need. So, very important. Dapat meron tayong short-term healthcare and long-term healthcare. So, when you say the word healthcare, okay? When you say the word healthcare, it's very important to note that HMO yan ha. It means Health Maintenance Organization. Health Maintenance Organization meaning hospitals will acknowledge that kind of HMO, meaning no down payment. Alright? So, by the time you get admitted, as long as meron kang HMO, no down payment. I want to emphasize this one because there are also programs out there you need to understand. They are called health insurances. Insurances. This is also a good program, okay? It's also a good program. The challenge is this one. Health insurance is not a healthcare program. Okay? Health insurance is not a healthcare program. We need to understand that one. Health insurance, usually, this is attached to a life insurance product. So this is, we need to be aware of this one. Okay? If you can avail both, maganda. Okay? But we need to understand the difference. Health insurance usually is an attachment to a life insurance product. Meaning, life insurance product talaga siya. It is not a healthcare product. Meaning, if meron kang health insurance, you have your own policy, you cannot show that policy sa hospital for no down payment. Okay? Kasi it's not a healthcare product. It's not a healthcare program. So we need to understand the difference. Usually also health insurances, they have what we call hospital income benefits. Okay? Again, depending on the program, may mga different benefits. That's why it's very important we understand all these benefits. Okay? So, sa healthcare program, sa HMO, kahit ano yung sakit mo, as long as covered, as long as you have funds, okay, covered yan. Okay? So, if I'm not mistaken, yes, there might be some limited, but usually sa HMO, covered talaga lahat, kahit anong sakit for HMO. Alright? And then, it also will be based on the coverage na meron ka. Let's say, for example, meron ka lang 60,000 annually, 60,000 lang talaga yung coverage mo. Alright? But again, HMO, they can cover any kind of sickness. Sa health insurance naman, meron silang benefit na hospital income benefit, meaning the number of days, okay, na nasa hospital ka, they're gonna pay you. Depending on the plan, let's say for example, meron kang 1,000 per day. Okay? So this is assuming na since nasa hospital ka, and you're not able to work, okay, the health insurance will give you 1,000 per day sa hospital. Okay? Pero if you ask me, parang kulang na kulang siya, di ba? Like, imagine, you stay in the hospital for 5 days. Yes, maganda, meron kang 5K. Pero usually, sa hospital, 5K lang ba yung babayaran mo in 5 days stay? I don't think so. Okay? What if yung bill mo is 20K? Kulang na kulang pa rin. Okay? But at least meron kang hospital income benefit. Right? Another benefit naman with health insurances is what they call critical illness benefit. Okay? This is good also. Pero from the term itself, critical, meaning you can only use the benefit kapag critical yung sakit mo. Like cancer, stroke, ano pa ba yung mga critical illness na yan? Okay? So, again, I'm not a financial advisor. I mean, like, ang tawag nito, not a life insurance agent talaga. So, I'm not really familiar with all this one. But, again, yeah, we need to familiarize ourselves. So, kasi yung CIB, usually meron silang list, di ba? Meron silang list. Kung yung sakit mo nasa list, covered ka with critical illness benefit. Usually, malaki yung benefit nito, like $500,000 to $1 million, okay? Critical illness benefit, like cancer. But the question is, sino naman gusto mag-cancer? Sino naman gusto critical yung sakit? Okay? That's why, from the term critical, it's a life insurance benefit. That's why we need to understand. Critical illness benefit is not HMO. Okay? Again, yung goal natin, healthcare. Once we get hospitalized, we are covered. Like what if yung sakit natin is not on the list of critical illness? Okay? Like severe diarrhea, okay? Like dengue, okay? Like headache. Mo hospital ba headache? Anyhow, what if hindi na belong dito? Okay? So we cannot use this benefit. Okay? Because it's a life insurance benefit. Life insurance benefit, in case something happens to us, kunin tayo ni Lord, we cannot move anymore, okay? We receive a lump cash. Right? This is another benefit we need to also avail kung kaya naman. Pero if we are looking for healthcare, dapat we need to make sure it's an HMO program. Okay? HMO program. Health Maintenance Organization is a healthcare program. Healthcare program is not equivalent to health insurance program. Okay? So, I hope this is clear. And then, if you can avail both naman, get a healthcare program. You could also get a health insurance program. If you can avail both naman. Okay? If kaya naman. Pero, if you're gonna ask me, kung pwede, you make sure you're getting a healthcare program. Right? So, once again, this is Tiyo. In next following video, let's tackle about life insurances naman. Okay? Different types of life insurance, how to compute, how to know if you are properly insured, okay? You are adequately insured, okay? And if you want to learn more about this one, marami ka natutunan, visit freedomloveph.com. Again, that's freedomloveph.com, and discover how you can create multiple sources of passive income. Alright? Once again, Tiyo here, and create your desired lifestyle. Bye-bye!